Hello everyone, this is Gary Anderson. Hope you all doing well. In today's video, I'll be talking about 7 low carb diet mistakes to avoid when you have diabetes. So, if you like the video related to my health, my way, I would like to request you always do subscribe to the channel, hit the bell icon, or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Carbohydrate increase blood sugar level. So it's only natural that cutting carb and turning to low carb diet is a common nutrition strategy for lowering blood glucose level and improving management of type 2 diabetes. For example, a study published in July 2020 in Clinical Nutrition has been found that a low carb, high protein diet is an effective strategy to minimize blood sugar spike in people with type 2 diabetes. And in a small study published in June 2019 in the Journal of Clinical Investigation, a low carb diet was shown to help people with metabolic syndrome, a cluster of conditions including abdominal obesity and high cholesterol, triglyceride, blood pressure, and fasting blood sugar level improve their numbers even when they don't lose weight. The first one, not exploring all of your low carb diet option. What low carb actually constitutes varies from person to person and researcher to researcher. No universally agreed upon recommendation exists for how many carbs you should eat on a low carb diet, explains Patty Urbanski, RD, a clinical dietitian at St. Luke Hospital Diabetes Care Program in Duluth, Minnesota, who has helped create past American Diabetes Association nutritional recommendation. That said, in broad stroke, getting less than 26% of your daily calories from carb can be considered low carb, according to an article published in January 2020 in State Pulse. For someone eating a 2,000 calorie diet, that would mean eating fewer than 130 grams of carb per day. Then it comes to not regularly communicating with your healthcare team. Your diabetes care team can help you determine the right low carb approach for you, but it can also help you avoid any bad, potentially dangerous, or life threatening side effect of going low carb to help manage type 2 diabetes. You and your doctor may need to lower or change your needs to avoid low blood sugar or hypoglycemia, cardiovascular complication, and diabetic ketoacidosis, which is a health emergency. This is especially true for people taking insulin promoting drugs, or blood pressure medication. Urbanski says additionally, SGL2 inhibitors, oral medication that assists the kidneys in lowering blood glucose level, push some people into potentially fatal DKA with the low carb intake, further exacerbating that risk. He says it's recommended that someone on SGL2 inhibitors should not go on a low carb diet or should first discontinue and change medication under their doctor's supervision, she says. According to the Food and Drug Administration, examples of SGL2 inhibitors include canagliflozin, dapagliflozin, and empagliflozin. Then it comes to not staying on top of monitoring your blood sugar. Following a low carb diet can help stabilize blood sugar level, but following a low carb diet doesn't guarantee that they are stable. Without careful monitoring, periods of hyperglycemia as well as hypoglycemia can occur, explains Vandana Seth, RDS, as Los Angeles-based spokesperson for the Association of Diabetes Care and Education. When you go on a low-carb diet, monitoring your blood sugar can provide important information that you can use to adjust meal portion as well as medication dosages. To get the most complete info and make the most informed decision, try continuous glucose meter, which takes a blood sugar measurement every 5 minutes or less. Medicare covers CGM for people who use insulin, and so may your private insurance. Then it comes to focusing too much on total carb and not enough on carb quality. For the best health, following a low carb diet should not just be about what you cut. It should also be about what you add into your nutrition plan. After all, a healthy diet meets all of your body nutritional needs and doesn't exceed your body's caloric need. But when people become narrowly fixed on reducing carb, they can easily wind up replacing those carbs with high calorie fat as well as chemically laden sugar-free foods and artificial sweeteners. When Following a low carb diet, the more you can focus on whole, unprocessed food, the better. These food can certainly include high fat foods such as olive oil, avocado, walnut, and salmon. But the exact amount of fat you should eat depend on whether you are following a ketogenic diet or trying to build lean muscle through an increase in dietary protein. Again, keeping an open dialogue with a registered dietitian is helpful. Then it comes to getting all of your carb at once rather than spreading them out. The lower you make your carb intake go, the more difficult sustaining the diet 24/7 can become. In some cases, you may be tempted to save your carb for dedicated high carb treat, meals, or snack, but resist the urge. Evenly distributing carb intake throughout the day is critical for preventing large dip and spikes in blood sugar, as well as keeping energy level up and the brain working at top speed. Should recommend that most people with type 2 diabetes aim to consume 30 to 45 grams of carb per meal. To figure out the right balance of, you divide your goal number of daily carbohydrate by the number of meals you plan to get throughout the day. Snacks also count toward this total but should generally be lower in carb compared with meals. Then it comes to missing out on fiber, which is a powerhouse nutrient. Fiber is critical to overall health, lowering blood pressure, improving insulin health, and encouraging weight loss by stabilizing blood sugar level and increasing satiety level. Problem is most Americans are not getting enough fiber when eating carb-rich diet, according to an article published in January 2019 in the American Journal of Lifestyle Medicine. On average, American adults eat 10 to 15 grams of total fiber per day, while the USDA recommended daily amount for adult up to age 50 is 25 grams for women and 38 grams for men. Women and men older than 50 should have 21 and 30 daily gram respectively. That's all about the diabetes in this video. I hope you all liked it. So for all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all, please do like, share, subscribe this video with the loved ones so that they will get to know better. So this is Carrie Anderson signing off. Please do take care of your health. We will definitely meet in the next video with my other content. Till then, God bless you. Bye-bye and take care.